Hello, my name is Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for induction of labor. Induction of labor is when the doctor causes a pregnant lady's uterus to contract, leading to labor. The uterus normally contracts in labor, but there are certain times where it's important for the doctor to start the contractions using medication. So this video is mostly to get you acquainted with the idea of induction of labor if your doctor tells you that it might be necessary. So tip number one, the reasons for induction of labor. The most common reasons for induction of labor are post-term pregnancy, which is when your pregnancy has reached 41 weeks. And this means you're pregnant, and this assumes that your pregnancy has been well dated, which is usually dated by an ultrasound before 20 weeks. Another common reason for induction of labor is pre-labor or premature rupture of membranes, when your water breaks before you go into labor. Intrauterine fetal growth restriction, meaning the baby is too small because it's grown to the limits of the uterus and can't grow any more. Preeclampsia or eclampsia, which are forms of high blood pressure in pregnancy, and fetal demise. Tip number two, the reasons that induction is not possible. There are certain situations where induction of labor is contraindicated or not possible. These are when there's been a prior classical cesarean section, and if you can obtain the hospital record, if you've had a prior cesarean section, this will help your doctor determine if your prior cesarean section was a classical incision, which basically means top to bottom instead of side to side. When you've had a top to bottom or classical incision in your uterus, it's not possible, or it's very dangerous to have an induction of labor. Other problems that prevent you from being able to have an induction of labor are problems mainly with the placenta or how the baby is lying, or if the umbilical cord is prolapsed or coming ahead of the baby, or certain other forms of umbilical cord problems, or if the mother has active genital herpes infection. Tip number three, the gray area. The rate of C-sections has increased dramatically over the past several years, and this is largely because of cesarean sections being done in a gray area where there are none of the reasons I described in tip one and none of the contraindications I described in tip two. So this gray area mostly consists of well-dated pregnancies, which is when the ultrasound was done before 20 weeks, and the pregnancy is at 39 weeks, and the cervix is favorable. So I'll describe favorable cervix later. So this basically means that normally a pregnancy will be induced at 41 weeks, but in this gray area, it's induced at 39 weeks. This gray area is generally not a good time to have an induction of labor, although many obstetricians will allow women to be induced at this time. Tip number four, understand the risks of induction. The risks of induction are if your cervix is not favorable, an increased risk of cesarean section, and if your baby is not fully mature, an increased risk of fetal lung problems. So induction of labor is not a standard procedure. It should be only done for one of the reasons I described in tip number one, because there are significant risks involved if it's done for other reasons. And so tip number four is how to basically prevent you from needing an induction of labor, and that's membrane stripping. Membrane stripping is when the examiner inserts his finger between the fetal head and the uterus and uses the finger to detach the fetal membranes from the uterus. This can be uncomfortable for the woman, but it can also lead to a woman going to labor by herself without needing a formal induction. Membrane stripping is generally offered to women at 39 weeks and weekly up until 41 weeks. Tip number 6, understand cervical assessment. So if the decision is made to be induced, then your doctor will likely assess the favorability of your cervix, which means how likely your cervix is to allow you to go into labor. And there's something called the Bishop score that you can become familiar with, which is how you rate the cervix's favorability. Usually if the score is 5 or above, then the cervix is considered favorable for induction. Tip number 7, cervidil. Cervidil is a prostaglandin, and it can be used in induction of labor. There are many kinds of prostaglandins used in induction of labor. Cervidil is one of the more popular ones. This type of prostaglandin is called dinoprostone, and it's a vaginal insert. So it goes into the vagina and it stays there until active labor begins, or for at most 12 hours. Cervidil is used if the cervix is not favorable, or if, again, the Bishop score is less than 5. Once the cervix has become favorable, then an amniotomy may be performed. An amniotomy is an artificial rupture of the fetal membranes, and it can only be done once the fetal vertex, or the fetal head, has been well applied to the cervix, and that there's no umbilical cord coming out, or there's no arm or leg protruding from the cervix. Amniotomy can be helpful for decreasing the total time that a woman is in labor once she's been induced. After the amniotomy, it's important immediately to start oxytocin. Oxytocin is the main way of causing induction of labor, and it's basically the natural substance that the woman's body produces to cause uterine contractions, but this is given through the pregnant lady's IV. So it started immediately after amniotomy, but shouldn't be done, but it should come at 30 to 60 minutes after the cervidil comes out. This is to avoid over-contracting the uterus. So tip number 10 is believe in yourself. I've presented some of the terms involved with induction of labor, some of the reasons for induction of labor, and some of the problems that can be caused if induction of labor is not done in the proper setting. I hope these tips have been helpful, and thank you very much for listening. Have a great day.